Which is that option? Option number D. Intubate and begin chest compression. That will be your answer. Why A is not correct? Bicarbonate has no role in the management of neonatal resuscitation, never given under any circumstance in a newborn. Giving epinephrine, heart is not beating, bradycardia is there. Giving epinephrine will not improve bradycardia. Till you have given chest compression, you will never give epinephrine. So B is wrong. Option number C, continue PPV and increase oxygen concentration. What is oxygen concentration going to do? The patient is going to go into bradycardia. You need to give more efficient respiration and also give cardiac massage. And so intubation and chest compression is the most logical answer. And only when intubation and chest compression has been done for 60 seconds in these patients, you will go for epinephrine. So when you are doing PPV alone, 30 seconds before moving to the next step, if PPV plus chest compression both, before going to the next step, that is epinephrine step, wait for 60 seconds. And this particular thing was the January 24 FMG MCQ. This is the January 24 FMG MCQ. So this case scenario 1, case scenario 2, case scenario 3, all the three are very, very important. And only on detailed neonatal resuscitation you have to read, but these three scenarios you have to add to the notes, right? Let's move further.